Is it true that masturbation destroys a man's potency? This single question haunts millions of men over 60, keeping them awake at night with crushing guilt and fear. Right now, as you watch this video, countless men are convinced that decades of private moments have permanently damaged their ability to perform. The shame is unbearable, and the worst part is they are torturing themselves over something that is not even scientifically accurate. Here is what terrifies me as a medical professional. Good men are destroying their mental health over myths that should have died decades ago. They are avoiding intimacy with their partners, refusing to seek medical help for real problems, and living in self-imposed prisons of shame, all because of misinformation that continues to spread like wildfire across the internet. I am Dr. Eva Hart, and I have dedicated 14 years of my career as a certified urologist to helping men reclaim their masculine vitality naturally. In my practice, I have witnessed the devastating psychological damage that these myths create. Men walk into my office broken, whispering confessions about their private habits as if they are admitting to terrible crimes. They come to me convinced they have destroyed their own bodies through completely normal human behavior. This is not your fault. The internet has become a breeding ground for terrifying stories and outdated Victorian-era beliefs that have convinced an entire generation of men that natural sexual behavior is somehow dangerous or destructive. Medical misinformation spreads faster than scientific truth, and men are paying the price with their peace of mind and their relationships. But here is what the medical establishment rarely discusses openly. The relationship between masturbation and erectile dysfunction is far more complex and far less frightening than you have been led to believe. The scientific reality will shock you because it is so different from what you have been told. In this video, I am going to reveal the complete scientific truth about masturbation and erectile function. This is not just about clearing up confusion, this is about freeing you from years of unnecessary shame and helping you understand what is really affecting your body after 60. This is about reclaiming your peace of mind and focusing your energy on the factors that actually matter for your sexual health. Stay with me until the end because I will show you exactly what scientific research reveals about this topic, which factors are actually affecting your performance, and what you can do about it using natural approaches that work with your body, not against it. And if this topic resonates with you, share in the comments what exactly speaks to you. Your courage to engage with this difficult topic helps other men realize they are not alone in their concerns. Your story matters more than you know. But first, I need to address the dangerous myths that are probably eating away at your confidence right now. The myths that are destroying men's peace of mind. Something truly heartbreaking is happening to men over 60, and it is completely preventable. Every single week, I encounter men who are living in psychological torment because they believe they have irreversibly damaged their sexual function through masturbation. The shame in their eyes is so profound that many cannot even make eye contact when discussing their concerns. This suffering is based entirely on myths, yet it is destroying lives and relationships every single day. The first myth that is absolutely decimating men's confidence is the belief that frequent masturbation automatically equals permanent impotence. This dangerous idea originated from Victorian-era medicine, when doctors believed that any form of sexual pleasure outside of procreation was physically and morally destructive. These same medical professionals once prescribed cocaine for depression and thought that bathing was unhealthy. Yet somehow their sexual theories continue to terrorize modern men. Men have been told that every single release somehow permanently depletes their masculine energy, weakens their sexual organs, or reduces their life force. I have patients who count every instance of masturbation from their teenage years, convinced they have used up some finite resource. They live with mathematical calculations of their supposed sexual destruction, as if their bodies keep a cosmic ledger of every private moment. The second devastating myth involves the complete misunderstanding of male energy and recovery. Countless men believe that masturbation exhausts the male body in some permanent, irreversible way. They think their bodies are like batteries that lose capacity with each use. I have encountered patients who have completely eliminated masturbation for years, believing this abstinence will somehow restore their youthful sexual function. This fear becomes so overwhelming that some men develop anxiety-induced erectile dysfunction purely from worrying about their masturbation history. The irony is cruel. They develop real sexual problems from imaginary causes, creating a cycle of dysfunction that has nothing to do with their actual physical health. The third myth that haunts men over 60 is perhaps the most psychologically damaging: the belief that masturbation past a certain age is pathetic, inappropriate, or automatically destructive to older bodies. Society has created this narrative that sexual self-exploration is only acceptable for young men, and continuing this behavior after 60 is somehow evidence of moral weakness or sexual addiction. What makes these myths particularly dangerous is how they prevent men from seeking proper medical care. While they are obsessing over masturbation habits, real medical conditions like cardiovascular disease, diabetes, hormonal imbalances, and medication side effects go undiagnosed and untreated. The actual causes of erectile dysfunction are being ignored while men torture themselves over imaginary problems. The time has come to replace these destructive myths with scientific reality, and what you are about to learn will fundamentally change how you understand your own sexuality. What science actually tells us about male sexual function? Through dedicating my career to understanding male sexual function, I can tell you with absolute certainty that the scientific reality about masturbation and erectile health is completely different from what most men believe. What I am about to share with you is based on decades of peer-reviewed medical research, not internet myths or outdated moral judgments. First, you need to understand exactly how erectile function works in your body, because this knowledge will immediately free you from years of misplaced worry. An erection is fundamentally a hydraulic event that depends on the coordination of your cardiovascular system, nervous system, and hormonal balance. When sexual arousal occurs, your brain sends signals through your spinal cord to the nerves in your penis. These nerve signals cause the smooth muscles in your penile blood vessels to relax, allowing increased blood flow into the erectile chambers while simultaneously restricting the outflow of blood. This process creates the hydraulic pressure that produces and maintains firmness. The entire system depends on healthy blood vessels with good elasticity, properly functioning nerves, adequate testosterone levels, and the psychological state necessary for arousal. Notice what is missing from this equation. There is no finite resource that gets depleted through use. There is no energy bank account that becomes overdrawn through sexual activity. Now, here is where masturbation fits into this physiological picture, and this information will revolutionize your understanding. Medical research consistently demonstrates that regular sexual activity, including masturbation, actually supports and maintains healthy erectile function throughout a man's entire life. Your penis, like every other organ in your body, requires regular blood flow to maintain optimal tissue health and function. Multiple large-scale studies published in respected medical journals have found that men who maintain regular sexual activity throughout their lives consistently demonstrate better erectile function as they age compared to men who avoid sexual activity. This includes both partnered sex and masturbation. The medical principle of use it or lose it has genuine scientific validity when applied to sexual function. Beyond maintaining erectile function, regular masturbation provides documented health benefits that become increasingly important after age 60. Research shows that regular ejaculation helps maintain prostate health by clearing the gland of potentially harmful cellular debris and reducing inflammation. Some studies suggest that men who ejaculate regularly have lower rates of prostate cancer, though more research is needed to establish definitive causation. What the comprehensive scientific literature definitively establishes is that normal masturbation patterns, whether that means a few times per week or a few times per month, do not damage erectile function in any way. Your body was designed for sexual activity throughout your entire adult life. The fear and shame surrounding masturbation are cultural artifacts with no basis in human biology or medical science. However, I believe in providing complete information, not just reassurance. While masturbation itself is beneficial for sexual health, certain extreme patterns can create psychological complications that affect sexual performance. When masturbation habits can actually create problems. I believe in giving you complete, honest information rather than just telling you what might be comforting to hear. While normal masturbation is beneficial for sexual health, Certain extreme patterns can create psychological and behavioral complications that may affect sexual performance with partners, especially for men over 60 who may already be managing age-related changes in sexual response. Primary concern is not the physical act of masturbation itself, but rather compulsive sexual behavior combined with excessive pornography consumption. Here is what happens in these situations. When masturbation becomes compulsive, meaning it interferes significantly with daily responsibilities, relationships, or becomes the primary method for managing all emotional stress, it can create psychological dependencies that interfere with real-world sexual experiences. Your brain is remarkably adaptable, constantly adjusting its sensitivity based on the stimulation it receives regularly. If a man becomes habituated to the intense, rapidly changing visual stimulation of modern pornography combined with the specific physical techniques and pace of masturbation, his nervous system may adapt by becoming less responsive to the different sensations, pacing, and psychological dynamics of partnered sexual activity. This is not permanent physical damage to sexual organs. It is neurological adaptation that can be modified through behavioral changes. Think of it like taste adaptation. If you eat extremely spicy food every day, milder flavors start to seem bland not because your taste buds are damaged, but because your nervous system has adapted to intense stimulation. I have worked with patients who masturbate multiple times daily while consuming increasingly intense pornographic material. Over months or years, they may find that the slower pace, different sensations, and emotional intimacy required for partnered sex do not provide sufficient stimulation to maintain arousal or reach climax. This creates a concerning cycle where they become increasingly dependent on pornography and masturbation. Another problematic pattern involves using masturbation as the exclusive method for managing stress, anxiety, loneliness, or depression. While occasional sexual activity for stress relief is completely normal and healthy, relying on it as the only coping mechanism prevents the development of other emotional regulation skills. However, I want to emphasize something absolutely crucial. If you are experiencing erectile dysfunction, compulsive masturbation is rarely the primary cause, and normal masturbation is almost never a contributing factor. The overwhelming majority of erectile dysfunction in men over 60 results from cardiovascular disease, diabetes, hormonal changes, medication side effects, and psychological stress. The real danger of focusing excessively on masturbation as a potential cause of erectile dysfunction is that it can prevent you from seeking appropriate medical evaluation for serious underlying health conditions. Erectile dysfunction often serves as an early warning sign for cardiovascular problems, diabetes, or other conditions that require medical attention. If you suspect that your masturbation habits have become compulsive or are interfering with your relationship satisfaction, the solution is not shame, fear, or complete abstinence. Instead, you need practical, evidence-based strategies. Practical steps for healthy sexual function after 60. Based on years of clinical experience and scientific research, I want to share practical strategies that actually work for maintaining and improving sexual function after 60. These approaches focus on supporting your overall sexual health through understanding rather than fear, and they address the factors that genuinely impact sexual performance. Regarding masturbation frequency, there is no universal magic number that applies to every man. Individual variation in sexual drive, physical health, and life circumstances means that optimal frequency varies significantly between men. What matters most is how you feel physically, emotionally, and relationally after masturbation. If you feel energized, relaxed, and maintain positive feelings about sexuality, your current frequency is likely appropriate. However, if you consistently feel physically depleted, emotionally guilty, or notice that masturbation is interfering with your desire for intimacy with your partner, you may benefit from adjusting your patterns. Key is making gradual, sustainable changes rather than dramatic restrictions that often backfire. For men who want to modify their masturbation habits, I recommend incremental adjustments rather than complete abstinence. Sudden elimination of all sexual activity can actually increase anxiety levels and create performance pressure. Instead, try gradually spacing out sessions. If you typically masturbate daily, experiment with every other day. Pay attention to how these changes affect your overall energy levels, mood, and interest in partnered intimacy. If you have been regularly using pornography alongside masturbation, consider reducing or eliminating pornographic material while maintaining some level of masturbation without visual stimulation. This approach helps your nervous system readjust to less intense stimulation patterns without completely avoiding sexual activity. When you do masturbate, focus on physical sensations, breathing, and your own fantasies rather than external visual stimulation. This practice helps maintain sensitivity to the types of touch, pacing, and psychological arousal that occur during partnered intimacy. However, masturbation management represents only a small fraction of comprehensive sexual health after age 60. The most significant factors affecting erectile function are cardiovascular health, hormonal balance, stress management, sleep quality, and overall physical fitness. These areas offer the greatest potential for meaningful improvement in sexual performance. Regular cardiovascular exercise provides one of the most powerful interventions for maintaining erectile function throughout life. Even moderate exercise like brisk walking for 30 to 45 minutes most days of the week can dramatically improve blood flow to sexual organs, reduce inflammation, and boost testosterone production. Sleep quality becomes increasingly critical for sexual function as men age. Poor sleep disrupts testosterone production, increases stress hormone levels, and reduces the physical energy necessary for sexual activity. If you are not consistently getting 7 to 8 hours of quality sleep, addressing sleep issues may improve your sexual function more than any changes to masturbation habits. Chronic stress management deserves particular attention because psychological stress can completely override physical sexual health. Elevated cortisol levels suppress testosterone production and create mental preoccupation that prevents sexual arousal. Whether through meditation, counseling, regular exercise, or other stress reduction approaches, managing life stress often produces remarkable improvements in sexual confidence. If you have concerns that your masturbation patterns have become compulsive, do not hesitate to consult with a counselor who specializes in sexual health. There is no shame in seeking professional guidance. It demonstrates wisdom and commitment to your well-being. Through everything I have shared with you today, I want you to walk away with absolute clarity about what genuinely affects your sexual health. Masturbation, when practiced within normal patterns, does not cause erectile dysfunction. This statement is supported by decades of scientific research and clinical experience. The shame, fear, and guilt you may have been carrying about this natural aspect of human sexuality is not protecting your health, it is undermining your peace of mind. The genuine factors that significantly impact erectile function after age 60 include cardiovascular health, blood sugar regulation, hormonal balance, medication effects, sleep quality, stress levels, and underlying health conditions such as diabetes or heart disease. These are the areas where you can invest your energy to create meaningful improvements in sexual performance. If you are currently experiencing erectile dysfunction, I strongly encourage you to schedule a comprehensive medical evaluation rather than continuing to worry about masturbation habits. Do not let fear or embarrassment prevent you from getting the medical attention you deserve. Early identification and treatment of underlying health conditions can prevent serious complications while often dramatically improving sexual function. Your sexuality does not diminish in importance as you age. With proper understanding, medical support when needed, and attention to the factors that truly matter, you can maintain sexual health throughout your entire life. Key is focusing your energy on evidence-based approaches rather than outdated myths. Most importantly, seeking help represents strength, not weakness. Your health and happiness matter, and you deserve to live free from unnecessary shame about your own body. Sexual health is an important component of overall well-being, and you have every right to pursue it without guilt. Stop letting misinformation control your thoughts and start focusing on the factors that will actually support your sexual health and overall vitality. Your masculine energy and sexual potential are not lost. They simply need proper understanding and support to flourish again.